My name is Dr. Marlon Rollins. I'm an administrator and a licensed clinician. I lost my sister, Amber Rose Rollins, to suicide in 2013, December 31st. The first time that I lost a client to suicide, I was actually a director of a crisis center. Again, it was a traumatic experience. Everyone was stunned in the department. As the leader of that department, it was really important for me to come forward with compassion and kindness first. So my role as a director was to create a sense of safety, and that meant checking in on my staff, making sure they had the support that they needed. We had to honor that there was a life that was lost, and that was absolutely critical for decision making. So we conducted what was called a root cause analysis. We did it several times, and we offered support to those individuals. We had to look at the systems that they were working in to make the improvements. And that was the critical piece. And it sent the message to the employees that we were interested in their workplace, to making sure that it was safe. They were our front line. So my job was to make sure that they had my support. Training really allows you to have the conversation, talk more specifically about populations at risk. So if you've gone through the training and you've prepared with your supervisor, with your team, you know exactly what to do. And instead of having that fight or flight response, which is natural to us, we know how to calm ourselves and begin to take thoughtful action with that client so that we can stay connected with them. When I lost my sister to suicide, it was different. It was more personal. I was in shock. Fortunately, I had peers that were around me that came in and checked on me. I remember going back to work, and I couldn't even hear the word suicide without getting triggered. You know, it was a sign for me that I'm not okay, that this was something that was obviously very traumatic. So it really impacted me on that level of like, I felt like I had no choice but to face that pain, because every day I had to keep showing back up. And I decided to lean more into that and use that emotional energy that I was feeling and have more compassion for myself. And it was soon after that that we received a zero suicide grant, and started to implement that. You need to understand more than anything that it truly is not your fault. The truth is, it's not your fault, and you can do something about it. You can grow, you can make a difference, you can create changes within yourself and within the systems that you're working in. Suicide prevention is never one person's job. It takes a whole team of people to really wrap your arms around that individual who's in a suicidal crisis. So honor yourself and honor the person that you've lost by doing something about it. Their life had meaning, and you can continue to bring meaning with them. Remember who they were, bring them with you every single day, and continuing to help people create new systems, new ideas, new plans, and new purpose. That's what being a great clinician is all about.